Hello, my name is Alex Queen. I'm the assistant editor of the American Journal of Medicine. I'm here with Dr. Alpert, our editor-in-chief. And in this month, we have an article about the 10 common misconceptions about hypertrophic cardiomyopathy. Tell us about it.
Well, it turns out that hypertrophic cardiomyopathy is a very common inherited heart disease. In fact, 1 in 500 people have a hypertrophic cardiomyopathy. We often refer to it with initials, like so many things in medicine. We call it HOCM, hypertrophic obstructive cardiomyopathy, because it can sometimes obstruct the normal outflow of blood from the heart into the aorta. And this disease was first described back in the 1960s. In a wonderful monograph by Dr. Eugene Braunwald when he was at the NIH. And of course, all these patients were very sick because that's how they got referred to the NIH. But subsequent studies have shown, Alex, that in fact the disease is very, very common and not necessarily as nasty as those initial very sick patients who were referred to the NIH. In fact, most patients have a normal life expectancy. I remember very clearly when I was back at the University of Massachusetts in Worcester, we had a family where everybody lived into the 90s. The mother was over 100 doing the New York Times crossword puzzle on Sundays, and they all had hypertrophic cardiomyopathy. So yes, it's a very serious disease. It's the #1 cause of sudden death in young athletes in the United States. But again, that's a very tiny percentage of the patients with hypertrophic cardiomyopathy. And usually there are signals that somebody has the form that's more malignant, more dangerous, in that they have fainting spells or dizzy spells or heart failure and so forth. But many patients with the disease require no therapy at all, although it's important to know that in the family these genes are being transmitted. And these authors went through a whole variety of misconceptions, that one I just talked about being one of the most important ones, that, oh, you get hypertrophic cardiomyopathy, you're going to die young. In fact, the overwhelming majority of people with hypertrophic cardiomyopathy do perfectly fine and live a full, long life. The other important thing to remember here is that certain drugs can make patients who are not having symptoms develop symptoms. So there are certain drugs that need to be avoided.
All right, and do you have a message for our clinicians?
Yes, well in fact, let's talk a little bit about a patient who has hypertrophic cardiomyopathy and also high blood pressure, hypertension. Those patients should not be treated with vasodilator drugs, that is the drugs that open up the small blood vessels. Drugs like calcium channel blockers, angiotensin converting enzyme inhibitors, angiotensin receptor blockers, because that vasodilation can actually make the obstructive component in the hypertrophic cardiomyopathy worse. So the treatment is usually with a central nervous system blocker such as clonidine or with one of the thiazide drugs. You should avoid the vasodilator. So that's an important point for clinicians. And also the important point is they should be looking for this disease. Many of these patients will have abnormal electrocardiograms. They don't show up early in life. They usually show up in midlife. And an echocardiogram makes the diagnosis. And then there needs to be some counseling that goes with it. The important point is that most people will do fine.
Okay, great. Thank you.